Yeah, the word trick is maybe not the best word. We're not trying to manipulate the patient. We know what's maybe in the best interest of the patient. However, the patient has to have some say in the treatment plan. So the trick, as you call it, is more a skill of expressing what empathy. And empathy is trying to, as a clinician, putting yourself in the place of the patient and trying to understand their situation, and then working with them in collaboration. You might give information that will be helpful for them, but you give them some options and some say in the decision making, because at the end of the day, the patients are the one that's going to make the final decision to take the medication or have the test or change their lifestyle and make that decision. So it's a skill of communication, and it requires the clinicians to listen and ask the right questions and be respectful and caring towards the patient. The patient may be doing something that you see as harmful for them. Maybe their lifestyle is the reason why they have a medical condition. So you have to use that careful communication to help them make a connection with their own behavior and what's really important to them in their health. And if we as communicators and medical professionals can actually help the patient make those connections, it's almost like a light bulb goes on. Yes, I need to avoid diabetes because I have to be healthy for my family. And sometimes life is passing by so quickly and people are busy and they're not taking a moment to think about their health. And so a patient once gave me a very interesting message. He said, you know, in the early part of our career, we give up our health to gain wealth. And we find towards the end of our career, we end up spending our wealth trying to get our health back. So it really kind of reminds us to practice preventative medicine. So I think as we communicate with the patients, we're always trying to prevent, preventing that next complication rather than react.